here's a bit of my thought process. If a patient presents with lower body symptoms that get better, the more distance the person runs in that run. I'm talking about anything from the low back, complaints there, all the way down to the toes. The main thing I'm thinking is that this really makes it very unlikely that the complaint is coming from contractile tissue or a lesion in a tendon or a muscle, because the more you run, the more you work it. So I would not expect the symptoms to decrease the more you ran on mile 5 versus mile 1, or at 50 meters versus 2 meters, for example. And the other opposite idea is that it's very likely this is a mechanical problem in a joint, not necessarily the joint where the symptoms are closest to or where they are, but somewhere. And that running is putting that joint in a position that it likes. And so the more you do it, the pain diminishes or abolishes. I can think of a really good example several years ago, and I think I put his video as one of the first videos that I put on Instagram, and the only video I've ever done where I asked a patient to talk into the camera. But he was a master's level sprinter. He had been to at least one, I think a couple clinicians who had diagnosed him with Achilles tendinopathy. But in his verbal history, and he wasn't getting better with their care for the tendinopathy, in his verbal history as a sprinter, he said, it really hurts when I come right out of the blocks, but by the end or close to 100 meters, the pain is gone. And he noticed this consistently. So in my mind, that doesn't sound like a contractile lesion, a tendinopathy. It sounded more like something mechanical. And for him, it was indeed mechanical. The position of being in the blocks with the low back in flexion versus the end of a sprint with the low back in neutral to possibly mildly or even moderately extended. Those are very different mechanical positions on the low back. And by restoring his low back extension, his Achilles pain went away. In those cases, we can ask ourselves, do we think it was radicular pain, refer pain, or just kind of a mechanical problem in one part of the body, creating symptoms in another via kind of unclear mechanisms, but the general umbrella of if the back's not moving well, it's affecting how things down below move. That question is debatable. For him, I don't think it was radicular. I don't think he presented with true neurological signs or deficit in the lower extremity. I think it's more kind of that third property, that part of something's not moving well here, so it's not going to function well here, and that's where the pain will appear. And it could appear in many different places for different people if the low back is not moving full into extension or has its full mobility. For him, it was just restoring low back extension via doing tons of low back extension with force, and his Achilles felt fine. His calf raise normalized, sprinting normalized, etc. So I'm thinking mechanical problems, the more you run, if you're getting better, that joint, the affected joint, is getting into a position it likes. Often we're talking about the low back, because the more you run, the low back is having a longer time in extension, which is very different than most of the day when it's in flexion. But maybe your hip is in flexion a lot when you sit, and so your hip complaint, when you start out running, it's there, but the more you run, it's getting better and better. Well, then we're starting to think it might be the hip extension of running that's therapeutic or helpful, because maybe in sitting, you're in flexion all day where the pain is unrelenting or doesn't see that shift, doesn't change. For the knee, it could be obviously either the knee, just like the hip, is doing some flexion and some extension, but compared to the rest of your activities in a normal day, the hip and the knee are typically more flexed in a normal day and get more extension when they're running into the hip extension and knee into more extension. And the ankle, I haven't seen many ankle complaints that get better with running that were from the ankle, to be fair, but we have to think about the mechanics of running and how much dorsiflexion or plantar flexion the person's getting. But all this to say, I'm really starting to think it's probably a joint not moving well, and something about how it's moving with the running makes it feel better. Of course, there are most patients that feel worse the more running they do. And then, yes, I'm starting to ask myself, do I think it's contractile, or do I think it's mechanical joint derangement, or do I, of course, think it's something else? The part of running that can make a mechanical joint derangement worse is that it's moving the joint into a direction it doesn't like. For example, if a back does not need extension, if the low back needs flexion to get better, then it would make sense that the more you run with low back extension, that will start to feel worse wherever the complaint is. Another option for having more symptoms with the more running you do is obviously the compressive load through the joints, not only of the low back, but also the lower extremities. But for those rarer cases where people get better the more they run, we have to be considering the joints, how they're moving, if they're moving in a direction that's contributing to the lessening of symptoms the more you run. And we have to be curious about looking at joints outside of where the exact symptoms are, just like in this Achilles example. I have another patient right now whose symptoms are bilateral Achilles and right hip. And she had noticed that when she gets out of the car and starts to run, the Achilles pain is there, and the more she runs, it goes away. That was a part of the puzzle that made me start to think her problem was low back. And it is a low back problem. It's 80% better now after a handful of visits, and we're continuing to focus on the low back for that bilateral Achilles pain. But this brings to mind also another patient I saw who was a runner who would report that when she kind of just left her house to run, she didn't have pain, but if she drove somewhere and ran, she had pain. And I forget if it was her knee or ankle or where it was, but the part that was pertinent in her case was the sitting inflection in a bucket seat in her car, which kind of primed that joint to have pain when she first started running. Whereas when she was just leaving her house, she didn't have that 15, 20, 30 plus minutes sitting inflection in the car seat. So we have to take that into consideration too. But start to think if someone's pain gets better the more they run, start to think it's probably not a muscle or tendon problem, and it might very well be a mechanical problem.